Yeah, you guys are welcome back. You guys are welcome back. So let's discuss. Are we good? Hello, guys. Are we good?
Yeah, good.
Okay. Now let's discuss on status the shock. Okay. They said lo stato di shock molto simile è un svenimento. They said the state of shock very similar to fainting. Okay. Svenimento means fainting. Eh? Eh? Determinato da una caduta di pressione da sangue che crea una riduzione de afflusso. Okay? Oh, pardon. Yeah, it's caused by a dropping of blood pressure that reduces the flow of blood. Okay? That reduces the flow of the blood. Okay? Now, then I said, con grave danni. Please, I want to ask a question. Who is wait, let me see. Somebody just joined the class and I don't know. Who is Zoom user? Who is Zoom user?
I think it's me. Oh. Hello, sir, it's me.
Because when you are coming, come with your name so that I will know those that are joining my class, okay? Yeah. So are we good?
But I don't know how to place the name
Okay.
permanently.
Okay, no worry. Later
Wait.
I will tell you that. Okay. They said, where are we? Where are we? Yeah. They said, che crea una riduzione dell'afflusso del sangue con gravi danni per cervello e cuore. Yeah. It causes a serious damage. It causes a serious damage to the brain, cervello, and cuore. Okay? Può essere causato da forte dolore fisico. Yeah, it can also be caused by strong emotion, strong feelings of emotion. Okay? Grave trauma, forte emozione, forte perdita di sangue. Yeah, very strong trauma. You know what to be trauma now. Then for a strong emotion or strong perdita di sangue, losing of blood, it can make somebody to shock. Okay? Then I say per manifestare attraverso diverse sintomi to manifest different type of sitting. They say presenza di privedi, pelle molto pallida. Okay? Lord, I'm having a scratch head. When your skin is so soft, when your skin is so soft, then sudorazione fredda alla fronte. You are sweating. You are sweating like a cold sweat is coming out from your front or from your body. Frequently battle the cuore. When your heart keep pumping, boom, 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 boom. They said, improvvisa pronuncia di fase a parola senza senso. Yeah. So you see, say some person they talk without they don't even know. Many people, it they happen to them. You just work out the goal, you will just talk. Without your brain, not be even your brain, they tell you what you want to talk. Yes. All these things, they be the symptom when they when you feel lead to shock. Okay. Then I said, il fortunato stato di shock deve essere senza a terra. A state of shock should be on the floor. Okay? In the sense that the person wants, if person want fall now, you know, if the person the first stand, no. The person want fall, is supposed fall for ground. E vai coperta per evitare dispersione di calorie. Yeah. If person see say person fall for ground, you have to quickly go. Go cover am. Cover the person. Make body for one small. Okay? Then I said, bisogno tenedori, se possibile. Le gambe sollevate. I think that should be a picture. Yeah. The check-out 20 to 30 minutes. Okay? The injured person should be laid on the ground and cover for a best position preventing swelling, preventing chilling. If possible, their legs should be kept elevated, should be raised. Their legs should be raised. Okay? If possible, their leg should be raised for like 20 to 30 minutes. Okay? Are you guys with me? Are you guys with me? Are you guys with me?
Yes, sir.
Yes, sir.
No problem. Then per favorire il flusso della sangue a cuore e a cervello, so that the circulation of blood can be moving from the heart and also with the brain. Okay? Remember, if you see a person shock, or they say you have to quickly carry the person like that, cover am, make body for one quick. If possible, raise the person leg, go up like 20 to 30 minutes so that the blood circulation will feel flow, go back to his heart and to his brain also. Okay? Any question concerning that one? Any question, guys? No one ask question, no problem. Let's go.
Mr. Justice,
Yeah.
Mr. Justice, the start of the show, that's where you are. Now, there are question I want to ask, like, start of the show, if you, if, for example, you have a sudden, maybe you're driving, you have a sudden fever just came on the person. Can
Mm.
you call that a start of the shock? Can you call that on the shock?
Uh, if fever come, that will not be shock now. Remember, shock be like, it's almost like fainting. Like person faint.
Yes, I know, but there are
But
certain
yeah, yes, sir.
there are certain this thing that will come like that. So
Mm.
I think I asked Staff that one too. The same question, the same answer is that you
Something
gave
like
now.
that,
It was not 100% like he said. Something like that is not. You won't call it a shock.
Yeah, it's
Start with a
not
shock.
a shock now. Somebody can be sick now. But you know what is associated with shock. Imagine, for example
Yeah,
now, do you say, although we have discussed it before, sometimes they will tell you the reason why you should not blow home when you are close to elderly people, right?
yes,
Because maybe elderly people now, those are yanning, they are crossing the road, right? They may not see
yeah,
you because maybe some of them have short-sightedness or whatever. Those people, they may not see you.
mm,
But now, when you are close to them, you now blow home. They can just fall because they are shocked. You know how shock is now. I mean, they never shocked you before. Not be correct shock.
yeah,
Oh.
yeah.
Not be, sometimes
I
there's
know.
some that are surprise. And the one where they call surprise because when you shock, you say you see stand, right? They call it a surprise. But the one where you
Yeah,
go make you go down,
yeah,
not a shock now. So if you feel the drive now, maybe feel like you come. You don't mean say you go just shock, you lose conscious. Uh-huh. I put that English, you understand? So losing conscious
yeah.
for a specified
Consciousness.
seconds,
Yeah.
I'd be shocked. So you just lose conscious. You fall go down. You don't remember where you did. You don't know anything again. And that's shock. So,
So,
so person if they drive
thank
now,
you.
FIFA fit come outside. If you see maneuver reach where Piazza the source day before you go back, you understand? Or enter consider the emergency, you go back. But shock will not be like that. Shock now just losing of your consciousness. You lose your consciousness, subito. So now it be shock. Okay. Now, see, okay, plus I don't even explain what I want to next now. Unconscious state of unconsciousness. What is state of unconsciousness? Se sei un ferito della strada è in stato di coscienza. One, if the injured person is in a state of unconscious, is in unconscious, or the unconscious person has done injury or whatever. They say, what do we need to do? One, no regesse a stimulo semplice. The person is in a state of shock. Okay, that person should not be taken care of. You should not allow this person to be taken care of for with their sex, okay? Or their stimuli. You know what is stimuli now? They are stimuli for those of now for people when they inside this group. Like your others, your sense organ. No, you see say all of them they don't they respond again. Okay? That because a person is shocked, he lose conscious. Maybe some of those organs, they not the moment you go everything just freeze. Then number two, they say, non è in grado di eseguire movimenti. That's when in shock. No, me say, na very big problem that you know if you move again. I mean, person when they unconscious. You know what to be unconsciousness now. Many people say, this person you're for you're unconscious. You now know what to be all these things, right? Then I said, non è in grado di rispondere è una domanda. Person when shock now, you call the person shock. I mean, person when they unconscious. You will call the ask her, what did they do you? What did they do you? You believe say the person will just they tell you, say, are they unconscious? So I don't know what they do. It's not possible now. You understand all these things. Many of them already they are used to all this. We don't even need to do more explanation. They said, no, no, sorry. No, essendo capace di provvedere e ha stesso bisogno vigilare sulle sue condizioni. The person when they conscious now, even if you open mouth, they tell you what they doing at that moment, right? Imagine the person they conscious now, you call their maybe police call corner, call the ask her, what happened to you when you say the person they conscious? Then first of all, you have to try your possible best to make sure say you come out for consciousness, right? Yeah, or the person that when they conscious now, even if they monitor what they are put to for environment again for the meantime until it comes back to consciousness again, right? They said, so the condition of prevention c'è cura fino all'arriva del personale medico. Just they try to do anything with the person. Maybe they try to the batter, I mean, they hit the body, just they hit his sense, to make sure say before doctor will come finally do what they supposed do. Okay? They say, muovono solo se si è certi che non abbia trauma alla colonna vertebrale. Maybe this person. Okay. They said it is necessary. Okay. That's why they are cautious. It is necessary for you to check whether they see they breathe, whether their respiratory system or these organs still they work. Okay. Check their breathing by placing your hand in their lower side of the chest. When I know how all those things be, or the lower abdomen. Check whether you see they breathe. Okay. Check in backside. Just all those organs where you go. I don't know. I'm not supposed to know all these things for primary school. So put your hand for near your nose like this. Whether some breath they come out, put your hand for your ribs like this. That vein where to check whether you see the breathe, all those things. Those are the things you can do until the arrive of a medical doctor. Okay. Bisogna verificare la respira echo. You have to verify whether the person see the breathe. Ancora prendere la mano sulla parte basso laterale di torace or sull'addome. Yeah. Put your hand, check whether the person see the breathe by putting your hand on the chest. Check the chest, whether you see the move or the lower abdomen. Put your hands again, check that vein for your hand like this. I don't know whether that's my hand or this vein for here. Check whether you see the move. Those are the things you can do for a person when they're unconscious until The arrival of a what? Of a daughter. Okay? Are we good? Are we good? They said, bisogno verificare. Yeah. Se respira spontaneamente, parlo di posizione laterale di sicurezza. Che moto causa strauta? Strauta su una fianco con testa reclinata all'indietro per favorire una buona respirazione. Yeah, try to carry the person when they're unconscious. Carry us down. Carry your head, go back like this. Okay? Carry your head, go back to see whether you feel get yourself for breathing. Okay? I hope you guys are following me. You guys are not answering me questions. You are not responding. I believe you guys are following. Then, like Gambia, Jata, carry a leg. Carry am be like say use carry am push the leg go far. But be like say I need to pull some pictures. I dey come. Let me bring some pictures so I may not copy how they speak it on. Okay, person when they are cautious, the things you supposed to do. Guys, you guys ask question. Oh. This is the second part of patenting. I make am e dey difficult because why? Now only one person they talk. Nobody. Now this one make patenting difficult. Only one person go dey talk, they talk, they talk, they talk, they talk, they talk. You see? Then you go make the class dey boring. I'm trying to bring some pictures. Let me show you guys some pictures. What to do. Echo one. Okay. Nothing more. Guys. Hello, guys. Hello, guys.
Sir, can hear you.
We can hear you, sir.
I hope this what is it called? This part where we did so those are I don't know. I don't know. Without say this part, it dey very stressful to now. Is this stressful to you guys?
It dey hard
Yes.
for more. Dey hard.
Yes, so
It dey hard.
It's
I know.
stressful. It's not difficult now.
It's not that difficult, but I know. Okay, let me bring some pictures, okay, so that we'll explain the last part. Nobody after this part, the next part, that one sweet well well. After this part, the next part, at least everybody go to contribute for that one. So come on, let me quickly bring some pictures. Now this second part of patenting, I made some people they don't come up for patenting. If you don't use this side, everybody will they'll just they don't tire. Well, you people should not give up, okay? For those of now who won't go that exam, you people should not give up. It is not about it's over. You can where's my name? Echo. Now they said first way they started the shock. Eh? Now carry make sure say leg did this position, leg, he did this position. Now try on a better make sure say the person leg carry sit down. Make leg did this position and the hand also to do this position. Who can tell me the reason? Mrs. Praise. Mrs. Praise, are you here? Yes, you are here. Open your microphone, man.
Yeah, I'm here.
They said now. They said somebody in what do they call her? Unconscious, right?
Yes.
Yeah. To
Yeah.
revive the person, either you put your hand in this position or you put your leg in this position. How true is it, man?
Yeah, for stability now.
Huh?
Say for stability.
Okay, so that he can at least you have stabilities to regain his consciousness back, right? Now remember, while the blood is flowing towards the vein or whatever, so when the blood got here, the blood should move back to go back again and go and settle on his heart and the brain, so that the brain can quickly recover to say, okay,
For
yes.
flood.
Huh? What, what did you say, man?
I just so that the blood so that the blood can flow well.
Yes, thank you. And you know why I ask you? At least you
No,
are in the
sir.
medical field, so you should know all these things without me stressing myself, right?
Okay, sir.
Yes, sir.
Good. So, guys, I hope you guys are following my instruction. I mean, sorry, explanation or whatever. So they said, try. First, when they are cautious, they have to try to boca apeta. You have to make sure say try to open the person mouth, okay? Try to open the person mouth. Revolta verso terra per facilitar the soluzione di liquido. In case they vomit, open him mouth, carry face ground. At least it go help am vomit put for ground without the vomit when he won't vomit. In case he dey revive himself, he no go enter him mouth again. For all these people. So guys, I don't say if I ask you now whether I get question, I will tell me say no. So I don't know. If I get, do you guys have question? Do you guys have question?
No, sir.
Okay, only one
No.
person. Only one person said no. Only one person said no. So guys, if I get question, you guys should ask. Okay, if there's no question, let me move on. Now, they said trauma alla gambia toricica. Toricica means fracture. Fracture, broken hand. Okay? Are you guys with me?
Yeah.
Sorry. Okay, let's go. Trauma alla gabbia. Gabbia. Gabbia means rib. Sorry. It means rib. Rib. Not the rib, they call it ribs. Okay, rib. One. Breaking of the rib. If person break a rib, what will you do as a first aider? You won't want help person when break a ribs. What do you suppose do? They said, trauma alla gabbia toracica può comportare fracture alle costelle o della semi-aggressiva della posizione lesione del polmone. It may involve fracture of the ribs or stomach aggressively by possible nose injury. Breaking of the ribs, it can also lead to possible nose injury. If I ask somebody now, what is the nose? I believe say somebody will not know. At least if I
What do
ask,
you call it?
sir,
What did you call it?
nose. No, I'm asking now, do you know what the meaning of nose?
What is spelling nurse? Nurse as in
Nose now, the one you use in, if I don't talk now, the one you use in respiratory, for respiratory system, nose. Not be
okay.
nose, so for hospital.
Lungs. Okay, lungs. I know.
Yeah, nose, not the nose.
Yeah.
Nose, for the one you use in respiration,
As in
for respiration,
yeah,
right?
as in LUNG.
Yes. Now they said this
Okay.
rib breaking, it can possibly affect the nose, okay? When the person get
Yeah.
injury and it break in ribs.
Injury. Okay.
They said, e fortunato respira con molto difficoltà. Yes, the person when he break a rib now, he will find it difficult to breathe, okay? He will find it difficult
Yeah.
to breathe. Patente occorrere, meaning difficultly, with great difficulty. Imagine you break your ribs, and your rib dey closer to your nose. And it go dey difficult to breathe well. Okay, maybe especially why did they talk all this one? Especially those when they drive machine, right? No be who dey some motor, or those are who dey some motor fit break a ribs. I don't know how come, but more no go there. Now, what should you do? What should you do? They said, cercare di facilitare la respirazione metodo semi-seduto. Semi-seduto. What you do to try to facilitate breathing by placing the person in a semi-seated position. Semi-seated position. You will use your weight, stay sit down. Okay? Without allowing them to take deep breaths. So if you use the, may not they use force or they breathe like at least, at least you go soft if you sit down with semi-seduta, then soft they breathe small because that time to breathe safe, it will be difficult for her not to use force. Because anytime we make the person use force to breathe like if it's not there, go see your ancestors. Okay? Is it okay, guys?
Allow me to take you to the village for a minute.
Wow, somebody's watching. Why would they class? That's a nice one. So, are you with me, guys? Now, then after two. Probigi, di bere e mangiare all'astello fino che arriva the soccorso medico. Yes, you have to prohibit the person from eating or drinking until medical personnel arrive there. Okay? You have to avoid the person not to eat anything or drink anything until medical personnel go around there or what do they call them? Proto Soccorso go come there. Okay? Is it okay? Forbidden from drinking or eating. Se vi è la presenza di ferita visibile e profonda, if the ribs is seeable, maybe the person break this now, the skin can't tear, then the ribs can't come outside. Bisogna comprimere subito con un pano pulito senza provare e pulire. They say quickly look for something, take cover am. Okay, so that make other people don't go to see am, say e reach, e break, e come outside for your body. Okay? Now they okay. Are you guys with me?
If person, I ask a question. If person break the ribs and come and say, no, that not be there.
But I not be waiting.
That person not go there. Because that not there.
No, you know
Many people don't break loose. They're still alive.
yeah, they are still alive.
I said the grace, that's the grace of the Lord. Don't you get it?
Depends on the gravity of it. So
yeah,
depending on the gravity of it, and that's where the person can. Well, maybe for example, he has 2, 3, 4 broken. Then if you have 1 or 2, the way he can survive. Just depend on how, like Mr. Justice said, depend on the number of ribs that got broken.
yeah.
So I think I have a friend here in Torino that had that. About 2 got broken. They were able to, manage one. One was still very, very severe. But at the end of the day, he's still living. Is okay right now. But it took time for about 6 months.
It must take time. It must take time.
Yeah, yeah.
So that is good. So they said, in case the injured place is deep and is very visible. It has a very visible wound and deep wound also. They say you should try immediately to compress it with clean cloth. Use clean cloth to, to try to hold on. Because the more the shoot come out, the more. Then without intending to clean or disinfect it or dress the injury, because that will be your work. Okay? Because that will be your work. They said disinfect or medical and no. This one will be your work. Your own is to use, remember on first aid, now we see they talk about first aid. Now we see they talk about your own to just help the person. Maybe carry cloth when clean. Use and help and hold that ribs. Okay, cover and like that. But the doctor will come. Okay? Any question? Any question, guys? Any question, guys? Any question, guys?
No question.
Okay. Now, see this next one now is, I'll see whether we can finish today. If not, tomorrow. I won't be able. Okay, let's see. Frattura agli Frattura agli atri. A broken bone. A broken bone, if there is a broken bone. They say la frattura la rotura de un osso. Also means bone, okay? Se eso fuoriesce della pelle della frattura è detta esposta. If the broken bone is out from your skin, if the broken bone is out from your skin, you know that thing is very painful, right? You know that thing is very painful. They say segni principale di una frattura solo il dolore violentissimo. Yeah, it's a very painful and a very aggressive pain. Your bone break. Ha. For those of you who don't break one finger before, you know how it be. Not to talk about say maybe your leg can't break or your hand can't finally break. Hey, they say ake a minimum movimento del ato. Even if just because of say it breaks small, you try to bend your hand small or your leg. You know the pain when you go generate, right? Now then I said, e gonfiaro or la deformazione della parte lisa. If that place, maybe for example now, you break your bone, you know come outside, it can't pump. It can't pump. You know how it be, right? It can't pump. For those of you who don't experience, maybe car door don't smash your finger join car one day. Then you can't go autopsy. You can't say that bone don't break. You know how it pay. You know how the sleepless night whatever where the person will face. Bro, it is very painful when somebody break leg or hand. If the bone come out, not to talk of say the bone can't choke your skin, come outside. Okay? Now what they said, si deve immobilare la frattura nella posizione in cui si trova per evitare lesione di nervi e vista e minimizzare. They said, if that thing happen, you have to, please, try your possible best before the arrival of a doctor. Try your possible best to make sure say that fracture, you find something to cover am first. Why did they always tell you say cover am? May you not go generate more infects, right? Remember, blood, it attract all those fly, whatever. Imagine I say all those flies call the fly enter, you call the patient. Then before you know, you go come give the person another disease. When you maybe after they don't treat the both finish, now you go call the fat disease over that.
One question.
Yes, sir.
The reason why they say cover am. I wonder that this one will correct to like because of hair, maybe breeze not enter you get.
Yes, that was it doing. Yeah.
Because the hair and child.
Because even the air itself is contaminated with germs, right?
Yeah, airborne disease.
Yeah.
That's true.
So, because if those air cause it the enter now, it can't give a disease and the other of the day now, because it don't treat the injury finish now, you can't go to fight a disease again, right? So that
Yes,
is why what is important is once anything happens, first of all, injury day, fire cloth, or because nobody plan to experience that kind of thing. Find something quickly cover am. Try to cover am, okay? Because one, now look at what they said. They said, remember, say if that thing happen, it can possibly portray and start to the shop. Imagine now, say, person now just break his hand or he break his leg. Then the person can't look his leg, see say bone they come outside. You know, say the person if he shock, if he lead to if he lead to unconsciousness. Yes. So that is why you have to quickly cover am. Okay. You have to quickly cover am so that even the person when he get the injury, you know, if see waiting they happen, but he go to feel the pain. But you know, if see not to go say, now my bone be this one for ground, or now my leg nice scatter like this. Yes. So subito. They say subito dopo è necessario attuare la normale misura anti-shock. Yes. Try to use all those anti-shock for the person. Maybe the person, you don't quick the person see the injury. You don't quick the person see body for ground. What should you do? You have to quickly use standard anti-shock measure to implement, which is lay the person on the ground with the leg that is broken or the hand that is broken. Lay the person on the ground, carry am like that. Okay? Make for not to see what happen to your body. I hope you guys are following me. Then they now said, in case of the fractura exposta, in the case of open fracture, come Claude dove l'oso, forza della pelle, which is the bone is out of the skin. Non si deve spingere l'oso. They say when the bone is out of the skin, non si deve spingere the bone. You don't know how to push the bone back to where it's coming from. Okay? You are not the right place to do that. Not they say maybe the ball they shoot out. Maybe you use your claw tape, they push and go back, they push and go back. No. What you should do, they said, occorre coprire la ferita e uso con materiale sterese o con una pannello pulito per evitare infezione. Yes. You're always not to push the bone. Well, you're always to quickly use something that is clean to cover that place where the bone for the come out for the person body. You are not a doctor. You should not spinging. Or maybe they will rat for you or they not rat. Another thing you should not do. Maybe the bone now is break. You got to see some part of the bone for ground. You are not in the shoe to carry those bones. Go they try to measure or to the face and back. No, you are not in that shoe. You always to just help the person cover where for injury quick. May breeze no enter. May James not go enter. Or make the person not go to see in bone, see say the bone they come out for leg, you go come faint. Like one of my Gambia friends for here, they work for metal mechanic. So as they work for fabric, iron come fall, come finish in leg. And the guy see his leg now. Before the guy, people when they inside the fabric and when they hear go, all of them. Imagine those iron for fabrica. Now, thank God said the leg not even cut it total, but the leg finish. Bone they come outside, all those things. When the guy say and I your friend, but the proto Soccorso come carry and carry the bone. But at the end of the day, when they reach the hospital, they say that bone not be bone when they won't fix again. So they come cut am, come pull iron for the guy leg. But to the glory of God, the fit use our cast small, but so that is the reason why if anything happen like that, don't let the person see wetin dey happen to a bone. Instead, carry cloth wey clean, use am cover am. Then they now said, occorre sempre attendere il soccorso. They say it is always for you to quickly call ambulance or not be ambulance they call them. Yes, proto Soccorso. Yeah, it is very urgent. If it's something like that happen, quickly call proto Soccorso. Lastly, they now say non è vero che è necessario chiudere alla vitamina della muovere gli atti or follow camminare per ridurre la dolore. They say it is not true that when something like that happen, you just carry cloth, cover the injured place, then you carry the person stand up, make the work up and down, make the pain for reduce. No, it is not true. But that is not your field. Guys, any question? Any question, guys?
Yes, I beg. Wetin quiz they call bone?
Huh?
Hello? Now
What
they
you
hear
talk?
me?
Yes, we
I
hear
say,
you.
wetin quiz they call bone?
Also.
Also. Okay.
Yes. Yes, sir.
You can
Okay.
also call it,
Thank you.
I think also OSA.
Also,
Also.
yeah. Yeah, for those of you that do quiz. So, guys, we'll see